Today, I'm examining Ashley Hahn, a volleyball player who has been experiencing pain in her right arm. Based on her history and the way she plays, I suspect that she has sustained a strain in her shoulder. The injury likely occurred due to the repetitive overhead motions during volleyball, especially from serving, hitting, and blocking, which involves overstretching the muscles in the shoulder or the upper extremities. These actions can lead to strains, which is essentially an overstretching of the muscle fibers. I suspect that this is a grade 1 strain, as Ashley's pain is mild and doesn't affect her daily activities, but has been noticeable during play. So first, Ashley's going to start with the rotation exercises. First, with internal rotation, Ashley's going to bring her right arm behind her back with the other bent. And pain can arise if the subscapularis or related tendons are affected.
Ouch, that hurts.
Okay. Then she's going to do external rotation while she keeps her elbow bent at a 90 degrees and slowly rotating her arm outwards. Tell me if you feel anything unusual or painful.
Ouch.
Okay. Now we will move on to the manual strength test to assess the function of the muscles around the shoulder. I'll ask her to resist from my forces during these motions. So first we're going to be starting with the empty can test. So she's going to hold her arms out in front of her, thumbs pointing down, and I'm going to be applying pressure downwards. Resist as best as you can.
Ouch.
Now that we know that the injury is affecting mainly the right arm, we'll be continuing the strength test with her right. So we're going to be doing her subscapularis strength test. So with her right elbow bent, place your hand on your belly and push outwards against my resistance. Next, we'll be doing the deltoid strength test. I'll apply pressure to only her arm as she tries to lift it to the side. She'll try to resist as hard as she can. Then for extra measures, we'll be doing the pectoralis major strength test. Ashley's going to push her arm in front of her while I apply resistance towards her chest. Now that we're done with the manual strength test, we'll conduct a few special tests to evaluate the integrity of the rotator cuff and other shoulder structures. Next, we'll be performing the drop arm test to start our special tests off. I'll raise her right arm to the side and she's going to slowly let it go. If her arm starts to drop suddenly, then it might indicate a sprain in the supraspinatus muscle, or a strain. Then we'll be doing the Neers test. I'll passively raise her arm straight above her head to check for impingement in the shoulder.
Ouch.
It hurts. Next, we'll be doing her Hawkins-Kennedy test. I'll flex her shoulder to 90 degrees and I'll rotate her arm inwards to assess for impingement of the rotator cuff tendons.
Ouch.
Next test for this will be the apprehension test. I'll externally rotate her shoulder while it's at 90 degrees of abduction to see if she feels any apprehension or pain. Next, for our final one for the special test, we'll be doing the Yergeson test. So she's going to bend her elbow to 90 degrees with her palm facing up. I'll apply resistance while you try to supinate your forearm. This helps evaluate the stability of the biceps tendon. For immediate treatment for Ashley, I recommend that she follows the Price method: protection, rest, ice, compression, and elevation for the next 24 to 48 hours. If the pain intensifies or you start to feel severe discomfort, an x-ray might be necessary to rule out any fractures or any more serious injuries. After 2 days of rest, we can gently start stretching exercises, and we will gradually progress to isometric and isotonic exercises to restore the strength. To prevent further injuries, Ashley needs to focus on proper shoulder stretching and strengthening exercises before and after her volleyball sessions. This will help improve her shoulder's endurance and reduce the likeliness of a strain. So the summary we get from this video is that Ashley Hahn, a volleyball player, likely has a mild rotator cuff strain in her right shoulder. Her symptoms align with a grade 1 strain caused by repetitive overhead actions. The drop arm test was negative, ruling out a full tear. Immediate treatment includes rest, ice, and gradual rehabilitation. Prevention includes strengthening and stretching exercises to prevent reoccurrence in the right shoulder.